Welcome, old viewers and new viewers, to another episode of the Dancing Negotiator with Dr. Cheryl Okoli, DHA. This is the show where you learn all about conflict and its resolution strategies, the what, the why, the when, the where, the who. I introduce evidence-based material or frameworks that are salient to the topic of conflict resolution or the topic of that particular episode. I like to use original mnemonics as an example, my original mnemonic of the 5 A's of conflict resolution, or mnemonics of other authors that have value for the conversation at hand. I like to reserve the third Fridays of each month to have story time. Story time entails the analysis of a case study, drama, movie, or an event. Assess and analyze what went wrong and provide useful strategies to address the conflict situation. The last Friday of each month is reserved to have a guest. Now, this guest might be an expert in conflict resolution or might have something very pertinent to share with us as we navigate this world of conflict. Welcome to the month of April. Today is April 1st, April's Fool's Day. But there will be no fooling around today or this month. And I do hope I do not have any technical issues which I had encountered prior to coming on here. So for the record, no fooling around today. And the theme for this month of April and next month is all about the business of healthcare. You may ask, what does she mean by the business of healthcare? I'm glad you asked. Let me start by saying that I'll talk a little bit about the business of healthcare and introduce a framework starting today called the Quintuple Aim framework. And we will address the very first aim of that framework. But before we go into that, let us talk a little bit more about my description of the business of healthcare. So first and foremost, you might notice that I always introduce myself as Dr. Cheryl Okoli, DHA. DHA stands for a Doctorate of Health Administration, and I describe myself as a doctor for your health administration needs, aka the business of healthcare. So let's start from the beginning. When you hear the word business, what comes to your mind? When people talk about business, sometimes people narrow their thought processes or focus on just the financial aspect of things. May I invite you to widen that lens, that paradigm shift of yours perhaps, to understand that the business of healthcare does not just pertain to the financial aspect. However, or rather, the business of healthcare can be likened to an umbrella, and under that umbrella are different sub-arms. So let's say, for example, think of a business of choice of yours. It doesn't have to be in healthcare. If you want, think of one in healthcare or some healthcare service. Think about what comes into function, into play, as you plan and deliver that business. Now, think about a house. How many of you have had this thought of, oh, I'm gonna build my dream house someday? Some of you might already be fortunate, you already have your dream house. But does it not begin first and foremost with having an image of that house in your mental mind's eye, so to speak? Once you have that image, then you usually bring out a pen and paper, or you use the computer to draw out what it will look like. And then you start gathering the human resources, the material resources, and every other thing you need to build that house. But the key is that the foundation of that house must be solid first before you can start adding other accessories, pillars, frameworks to this house, right? So in the same token, when I think about the business of healthcare, think of a service. Let's say, for example, a new party decides to introduce a wellness service to their community or for their nation. The key is, first and foremost, they must have a mental image in their mind's eye, aka the vision and the mission. So the mission is, why does it exist? What does it plan to do? The vision is, where do they plan to see themselves in the future? What are they trying to achieve? And the goals are the tangible, measurable steps to achieving the mission and the goals. And of course, they have to have values, right? So that high level overview can be considered, not can be considered, is the strategic direction of this new organization that's trying to be created. So when you talk about strategic management, it entails strategic planning, strategic execution, and strategic implementation. And yes, financial stewardship is under the planning and the execution part of things and implementation. So let's say you're trying to create a wellness service. My question to you is, what differentiates your organization or this service than all other services in the vicinity of where this organization or business is going to run? What makes you so special? What is your competitive advantage as opposed to all other wellness delivery services? That in itself is one of the keys to your success. And competitive advantage analysis is an example of strategic management, specifically strategic planning. So some of you in leadership roles and senior management and consultants to healthcare industries or businesses at large, regardless of industry, are familiar with some analysis tools like the SWOT analysis, which is basically looking at the strengths, weakness of opportunities and threats. There's the PASTEL. There are other models one can use. But specifically, when you also talk about the competitive advantage, specifically differentiation, I like a framework by someone called Porter to look at that aspect of things. So when I talk about the business of healthcare, I'm going to elaborate a little bit more. How? By showing you a little bit of the services I offer, and hopefully that will give you a visual as to what I'm talking about. So I'm going to share my screen here, and I hope you'll be able to see it, and we won't have any challenges. But nevertheless, so what I want to share with you is specifically what I offer for administrative services, like I alluded to. And I want to zoom in on strategic management, using the example that I mentioned of the wellness organization that someone might be thinking of creating. So right here, strategic management. So some of my services that I offer high-level strategic management services and anything to do with organization development. As you can see, that could include work quality improvement, risk management, change management. And under each of these arms are sub-arms. You can think of them as tentacles, because these are big domains, big chunks that an organization and a leader has to evaluate and look at during the planning process and evaluation process. And under each, let's say, for example, strategic management, are sub-arms. So going back to the strategic planning for any business, that could include, okay, what are the logistics in terms of the type of staff, workforce? What does the workforce entail? What is the expertise required for the human resources, for example? Financially, what's the budget needed for each of the program this particular wellness service, as an example, would offer? What is the risk management going to be like? So on and on. What is the leadership? What is the managerial style, right? So as much as these boxes, if you will, appear to be self-explanatory, there's so much more detail that goes into that. So along those lines, I will stop sharing my screen for now. And what I want to talk about is how it is important that one understands that even though I might have a plan to cater to a particular organization, it has to be it has to be client-centered. So what do I mean by that? So in this token, let's say that a wellness organization or service is a particular client, target client, right? You can't just use a framework, a generalized framework for every organization. You have to tailor it specifically to the organization at hand, right? So that brings me to another point I want to mention to you. So when we talk about the business of healthcare, again, just like I like to describe the human being as a holistic being comprising the physical, the emotional, psychological, social, cultural, and spiritual, an organization in a way, a business in a way, can be deemed holistic. It cannot function independently, because think about it. Yes, it has its internal resources, but you need external resources. As an example, vendors that will help support the services that it's delivering, right? It might have internal IT support, or it might have external support supporting them, right? So with that in mind, I hope you have an understanding of what I mean as the business of healthcare. Is every aspect of that business that helps it operate smoothly to increase organization productivity, and also, of course, employee satisfaction as well, okay? So now I mentioned one of the frameworks, Quintuple Aim. So some of you may not have heard of this. You might have heard of the triple or the quadruple aim. Let's backtrack. Triple, 3. So historically, organizations, specifically in healthcare, were using a framework called the triple aim, which basically comprises, number 1, improving the health of the client. Also might say patient. 2, improving the health of populations. 3, doing both of those prior or aforementioned steps or goals in a cost-effective manner. So improving the health of the client, improving the health of population at a cost-effective manner. Okay. So going back to that analogy I used of the wellness center, one might be thinking of creating. What is the population that one is targeting? Are you target, because population, the layman's way of describing it is just thinking of a group of people that have a shared characteristics, okay? So you can classify it by geographical location, so of a city, nation. You could classify it as in age, so it could be seniors, pediatrics, and young adults. It could be in terms of a shared morbidity, maybe they have the same disease as hypertension. Or it could be a group of professionals, nurses, physicians, pharmacists, dentists, you name it, IT department, social workers, whichever population, whatever makes them have a shared unique characteristics. So what is that target population the wellness is trying to reach? So it's important to mention that. But for today, we're focusing on the first part of the quintuple aim, which arose initially from the triple aim. So I've mentioned what the triple aim is. Then the quadruple aim, which means 4, which means a 4th component was added to it. And what was that? Care of the healthcare provider. And the 5th, making it the quintuple aim, is burnout. So do not fret. For today's episode only, we're only going to talk about the first one, which is improving the client's health. Now, I want us to dissect that notion of improving the client health. Usually, healthcare services are traditionally known for treating the human body, mostly the physical component. And then there's some that specializes in treating the mental component, or a mixture of an organization that has or caters to both physical and mental. But more and more as we evolve and progress, we understand the value in looking at the holistic domain of the human being. So it's very rare that one facility or one service will offer services specific only to one domain of those holistic framework that I mentioned, right? So as we talk about now improving the health of the client, let us define client. It's very important that we define the client. Why? Because depending on what healthcare organization you find yourself, what role in that organization you find yourself, you might be surprised that 2 parties from 2 different roles in the same organization may not be using the word client the same. Let me start by explaining this. I reside and practice in Alberta, Canada. Three terms in the healthcare industry can be used to describe or define an individual or a party or an organization seeking healthcare services. Let's focus on the individual, okay? So in the acute care settings like the hospitals, the individual seeking some medical attention or healthcare service is called the patient. In the community environment, like let's say in the home care setting where health care is provided and delivered in the home care setting, or some other affiliate partner organizations in the community, that individual seeking healthcare of some service, health service of some sort, including social services, is called the client. In a long-term care facility or supportive living environment or assisted living environment, that individual is called a resident. I just thought it's important to just make sure that these different terminologies are explained and understood. Now, coming back to the comment I made about how the client could be used or perceived differently by two different employees of the same organization. And that will help us talk about more about how can you improve the health of the client. So let's say, for example, let's look at it from the lens of the individual seeking a healthcare need. How do you improve the health of that client? Yes, organizations have clinical guidelines, policies to govern the operations, the clinical operation and practice of that healthcare facility or organization. The key for the clinical guidelines are the guidelines. They're not set in stones, but they're guidelines to guide the practice. Policies are usually set in stones. However, most organizations are beginning to realize that those policies need to be reviewed frequently because things change. Like, for example, in our world with the pandemic, things change. Existing policies became, I won't use the word archaic, but they weren't relevant to what some organizations found themselves in. They had to either tweak it or create new policies as an example. So I still believe as much as policies are supposed to be set in stone, there should be some room for flexibility in how they can be implemented, given the individual needs of the clients. Hence, that concept of client-centered needs or patient-centered needs, okay? So for that individual seeking a healthcare service, how do you improve their health? Number one, hopefully you have the right staff to meet the needs. You have the support services, the infrastructure to support the needs of what they need, or their needs, be it from a clinical component, be it in support services, the interdisciplinary team, communication. And when I say communication, I'm not referring to verbal, but in terms of like, how do you communicate, like for example, booking appointments, following up appointments, dissemination of information as an example, right? Now let's look at client from the lens of an employee in an organization. You might ask, how is that possible? I'm a little bit confused. So now we're going to substitute client for an employee who is not seeking a health service or works in an organization that supports the individual seeking a healthcare service. Why am I honing in on this? Why am I emphasizing this? I have seen from my practice and from my original research that sometimes the perception of who a client is in an organization has sometimes been the bone of contention as it pertains to interpersonal relationships from a vertical manner. Let me explain. So I'm going to paint a little bit of a hierarchy, if you will. And yes, I know an individual coming to a healthcare service organization to receive care, we like to see them as partners of care. However, the reality is there can be a power imbalance, right? So let's just say you have the client, you have the frontline staff that meets the needs of the client, you have the frontline staff that reports to the frontline manager. Frontline manager reports to their project manager, area manager, program manager, not project, I meant to say program manager or area manager. Area manager reports to senior leadership as an example, okay? Did you know that sometimes the frontline manager or the operational manager, their client, is the employee reporting to them, not the client seeking a healthcare needs? It's very important to keep that in mind. So when you're working at an organization and the word client is being used, make sure you're speaking the same language. So how can we care or improve the health of the client, in this case, who's the employee? So let's say, for example, an employee incurred a workplace injury, or they were injured outside of work, excuse me, and they have to return to work. Let's say the injuries are such that they need ergonomic equipment. There is a law in the Alberta Human Rights that says it's a duty to accommodate, as long as it doesn't provoke or involve undue hardships. I'm paraphrasing, but there is the expression undue hardships there. So how do you care for this employee? How do you improve the health of this employee, regardless of how the injury was acquired, be it from the workplace or outside of the workplace? Given that this employee is valuable to you, well, you need to have a one-on-one with this employee, find out what their needs are, and this can come through the family physician and other parties that provide documentation saying exactly not what the injury is, but what the ergonomic needs are in terms of a workstation, maybe the physical environment, in terms of temperature, and so on and so forth. Another way of improving the health of an employee, that's your client, could be making sure that the working hours are doable, satisfactory, and other perks in the organization that enhances employee satisfaction. So those are examples of how one can look at improving the health of the individual client seeking a health service, or the employee as a client, for example, okay? So I hope that helps you understand that, because it's so crucial that one does that, because when you look at improving the health of the client, I've seen this model of the quintuple aim or quadruple aim applied in non-healthcare settings. So the framework works. You just have to substitute the word patient or client for whatever party it is coming to your industry to receive help. So in the business world, the business of care, that could include, okay, how do we make healthcare services accessible to for our target population? Is it a transportation issue? Is it the timing of when we deliver services? So let's say, for example, if an organization or facility is delivering hours from 9 to 5, what about clients who need that organization but are unavailable after services, like after 5 p.m.? Who meets their needs? Well, an organization can be unique and differentiate themselves by meeting those after-hour needs, for example, right? So that, again, improving the health of the client. And again, when I use the word health, think of it from a holistic perspective, looking at the structures in place in your organization. So again, that could be, yes, the physical environment, the workstation, the workplace, the work location. What are the support staff? What do you have? What are the tools? What's the orientation to help equip the workforce to serve this client, to make sure that the health of the client is improved? So I hope that helps explain what this first goal or aim of the quintuple aim is: improving the health of the client, be it seeking a physical need, mental need, or your employee as the client. Later on in subsequent episodes, we are going to hone in on the care and expand more on the care of the employee, the healthcare provider. Okay, so this is just a brief introduction as to what we're talking about. So now, let's talk a little bit about the calls of actions that I might have for you. I'd like you to reflect on these questions. What unmet client need can you meet this month in your organization? What employee need can you meet this month? Have you identified a need, but don't know how to go about meeting it? That is where consultants come in handy. As an example, you can call me, contact me at cheryl@shalomeagleswings.care. That's my work email address. You can also reach me at my website, www.shalomeagleswings.care. My website has a list of the different services I offer, the prices associated with that. Yes, I mentioned I am based in Alberta, Canada, but guess what? The beauty of the virtual world. Any of these administrative services can be done virtually as well, not just face-to-face or via telephone. So I was just wanting you to know that. So a recap of what we've talked about so far. We started off today introducing what I mean when I talk about the business of healthcare, when I describe myself as a doctor for your health administration needs. We talked a little bit about what the quintuple aim, when I say talk about, I identified what they are, the quintuple aim goals. Our focus for today's episode was solely on the first goal or aim, improving the health of the client. And in subsequent months, we are going to talk about each of the 5 goals, well, the remaining 4 moving forward of the quintuple aim goals. So what was a resource? A resource that I found for the quintuple aim goals, for example, was an article that I found, which is dated 2016 by Epperson, Childs, and Wilhoit. It is titled Provider Burnout and Patient Engagement, the Quadruple and Quintuple Aims. Now put on your thinking hat, substitute the word patient for client or resident or for employee, okay? So on that note, I'd like to leave you with a thought, which I love to leave you with. But before that, you know you can always find me here, same time, same place for another episode of the Dancing Negotiator with Dr. Cheryl Okoli, DHA. But I want you to remember that you, that's right, you are needed in this world to be a solution. Be the best that you can, and do not rob the world of a precious gem, you. That's right, you are special, you are precious. Have a splendid day. Goodbye.